Reckless, dangerous, unethical. Dr. William Harrison's words echoed through the hospital boardroom as he paced in front of the Medical Ethics Committee. Dr. Zhang's insistence on pursuing these alternative treatments puts patients at risk and damages our hospital's reputation. I sat quietly, watching my former mentor systematically destroy my career. 10 years of research into integrative medicine approaches for treating chronic autoimmune conditions, about to be dismissed as dangerous quackery. I'm Dr. Sarah Zhang, and this is the story of how the medical establishment's attempt to silence my research led to the exposure of $1 billion pharmaceutical fraud. Dr. Zhang combines unproven Eastern medicine techniques with experimental protocols. Harrison continued, clicking through slides showing my treatment methods. She's turning our respected research hospital into a glorified holistic healing center. The committee members nodded along, already convinced. They didn't care that my patients were showing remarkable improvement rates. Didn't want to hear about the successful integration of traditional Chinese medicine with modern immunotherapy. All they saw was a threat to their upcoming clinical trial for PharmaCorp's new miracle drug, Immunorist. Furthermore, Harrison gestured to a chart. She's been actively discouraging patients from enrolling in our approved clinical trials. This is a direct violation of hospital policy. Because I'd seen the preliminary data they were hiding, I thought. Because I knew what their miracle drug was doing to test subjects. Dr. Zhang, the committee chair, turned to me. How do you respond to these allegations? I opened my laptop. I'd like to present my patient outcome data. We're not here to discuss your alternative methods, Harrison cut in. This is about your interference with approved research protocols. My patients' recovery rates are irrelevant without proper double-blind trials, he snapped. Your mixing of traditional remedies with modern treatments makes it impossible to validate any results. I thought of Mrs. Chen, who could walk again after 5 years of conventional treatment failure. Of Jason Martinez, now in remission from an incurable condition. Of dozens of patients who'd found hope after the established protocols had given up on them. The trial data for Immunorist is flawed, I said quietly. The side effects. That's enough. Harrison's face reddened. This is exactly the kind of unfounded accusation that damages our institution's credibility. The committee chair cleared his throat. Dr. Zhang, pending a full review of these concerns, your clinical privileges are suspended. Please surrender your hospital ID and access cards. As security escorted me out, Harrison caught up to me at the elevator. Sarah, his voice softened to the mentoring tone I remembered from my residency. You're a brilliant doctor. Stop this crusade against proven medicine. Come back to real science. I met his eyes. Real science follows the evidence, no matter where it leads, even when it threatens corporate profits. Don't be naive. Medicine is a business. PharmaCorp's grant funds half our research department. And how much of your personal portfolio? His face hardened. Clean out your office by tomorrow. Later that evening, as I packed my research files, my phone buzzed with a text from Jenny Wang, our lead research nurse. 3 more trial patients hospitalized. Severe complications. Harrison ordering data modified. Need to talk. I had been tracking Immunorist trial patients through my network of nurses and lab techs. The official reports showed promising results, but the reality was darker. Severe autoimmune reactions, organ damage, complications that were being systematically buried in the data. Dr. Zhang. I looked up to find Maria Garcia, one of the trial patients, standing in my office doorway. Her hands trembled slightly. The side effects, they're getting worse. Dr. Harrison says it's normal, but I pulled out my prescription pad. Come to this address tomorrow. It's my private clinic. We'll talk there. After she left, I called Dr. Lai Wei, my mentor from medical school in Beijing. The hospital suspended me, I told him. As expected, his calm voice replied. And your other preparations? Everything's in place. The private clinic is ready. And the real trial data. Safely backed up and verified by independent labs. When do you move? I looked at the photo on my wall, my graduation from medical school, standing between Dr. Li and my father, who'd sacrificed everything to send me to study medicine in America. They're announcing preliminary trial results next week, pushing for fast-track FDA approval based on manipulated data. And your evidence? Irrefutable. patient records, lab results, internal emails discussing data manipulation. Plus, I smiled slightly. Detailed documentation of how my dangerous alternative treatments are actually helping the patients they're killing with their miracle drug. That night, I worked late in my private clinic, reviewing patient files. 10 years of careful research combining the best of traditional medicine with modern techniques, treatments that worked but threatened the profitable status quo. A knock at the door startled me. Jenny slipped in, carrying a thick folder. Latest trial data, she whispered, though we were alone. They're pushing through approval before the severe complications become obvious. 3 patients died this week. The reports list unrelated causes. I opened the folder. Page after page of falsified data, manipulated test results, hidden complications. Harrison's presenting to the FDA next Thursday, Jenny continued. Once they get approval, they'll bury the real numbers in post-market studies. Thursday, I repeated. Perfect timing. For what? I showed her my own presentation, prepared for the same FDA meeting. For showing them what real medicine looks like. The next week was a blur of preparation. While Harrison and PharmaCorp prepared their carefully sanitized presentation, I gathered evidence. Trial patients quietly visited my clinic, their stories and medical records building an undeniable case. The truth about Immunorest was going to come out. But more importantly, the truth about real healing. About combining the best of all medical traditions to actually help patients, would finally be heard. Sometimes the most dangerous thing you can do in medicine is follow the money instead of the evidence. Harrison and PharmaCorp were about to learn that lesson the hard way. The question was, how many patients would suffer before the truth won out? The FDA hearing room was packed on Thursday morning. PharmaCorp's executives filled the front rows, their confidence radiating through expensive suits and practiced smiles. Dr. Harrison sat with them, reviewing his presentation one last time. I sat quietly in the back, Jenny beside me clutching a thick folder of evidence. My father's words echoed in my mind. True healing comes from wisdom, not power. Remember that when they try to silence you. Dr. Harrison, the FDA committee chair, began. Please present your findings on Immunorest phase AI trials. Harrison approached the podium with his usual authority. Ladies and gentlemen, Immunorest represents a breakthrough in autoimmune disease treatment. Our trials show an unprecedented 85% improvement rate. I watched him click through carefully curated slides, presenting manipulated data as scientific fact. Each chart told a story of miracle cures, while real patients suffered in hospitals or sought help at my clinic. The side effect profile is remarkably clean, Harrison continued. Minor complications in less than 5% of cases. Excuse me, I stood up. I have evidence that contradicts these findings. The room erupted in whispers. Harrison's face darkened. Dr. Zhang is a disgraced physician whose hospital privileges were recently suspended, he said quickly. Her testimony is not. I have sworn statements from 38 trial patients I cut in, documenting severe complications that were deliberately omitted from the trial data. The committee chair frowned. These are serious allegations. I also have internal emails and original lab reports showing systematic data manipulation. I nodded to Jenny, who began distributing copies of our evidence, including documentation of 3 deaths that were ruled unrelated despite clear causal links. Harrison's professional mask cracked. This is absurd. Dr. Zhang is bitter about her suspension. I have more, I continued calmly. Comparative data showing how these same patients improved using integrative treatment protocols that PharmaCorp dismissed as unscientific. Maria Garcia stood up from the audience. Dr. Zhang saved my life after Immunorest nearly killed me. Everything she's saying is true. More patients stood, one after another. People whose stories had been buried in manipulated trial data, whose suffering had been dismissed as statistically insignificant. The FDA committee spent hours reviewing our evidence. By day's end, Immunorest's approval was suspended pending a full investigation. PharmaCorp's stock plunged as the truth emerged. But something else emerged too, proof that my dangerous alternative treatments actually worked. Your outcome data is remarkable, Dr. Susan Chen from the FDA told me privately. We'd like to establish a formal study of your integrative protocols. The next few months were intense. While PharmaCorp faced investigations and lawsuits, my clinic became a case study in successful integrative medicine. Researchers from major hospitals came to observe our methods to understand how we combine traditional wisdom with modern science. Harrison tried to discredit me one last time. "You've destroyed years of research," he confronted me in my clinic's parking lot. "Cost the company billions." "I saved lives," I corrected him. "That's what doctors are supposed to do." "You're still naive," he snapped. "Medicine is a business." "No," I cut him off. "Healthcare is a service. Making it just a business is what went wrong." 6 months later, I testified before a Senate committee on medical ethics and pharmaceutical testing. My story sparked new regulations on trial data reporting and increased recognition of evidence-based alternative treatments. Dr. Lai flew in from Beijing to help us establish a teaching program, sharing his knowledge of traditional medicine with Western doctors eager to learn. "Your father would be proud," he told me, watching medical students train in both modern labs and traditional healing arts. "You've built a bridge between worlds." The hospital that had suspended me now wanted to establish an integrative medicine department. I agreed, with conditions: complete transparency in all research, and patients' needs above corporate profits. 1 year after the FDA hearing, I stood in my expanded clinic, watching patients receive treatments that blended the best of medical traditions. Mrs. Chen practiced Tai Chi in our meditation garden, her rheumatoid arthritis in remission. Jason Martinez discussed his treatment plan, combining immunotherapy with traditional herbs that enhanced its effectiveness. Jenny, now our research director, brought me the latest outcome studies. "Conventional hospitals are adopting our protocols," she said excitedly. "The results are even better than we hoped." I touched the jade pendant my father had given me in medical school. "Because we're finally using all the tools available, not just the profitable ones." Last week, a young doctor asked me why I risked my career to fight the system. "I didn't fight the system," I told her. "I showed them a better way." True healing has always been about wisdom, not power. Now my clinic hosts doctors from around the world, learning to integrate different healing traditions. Even some of my former critics have become supporters, seeing the evidence they once dismissed. Harrison left medicine after the PharmaCorp scandal, his reputation destroyed by his own choices. Sometimes I think about his last words to me: "Medicine is a business." He never understood that healing is an art, supported by science but guided by wisdom. That's what my father taught me. What Dr. Lai showed me. What every patient who trusted us proved. Yesterday, I received a letter from the National Institutes of Health. They're establishing a new research center for integrative medicine based on our model. They want me to lead it. Looking around my clinic at the blend of modern medical equipment and traditional healing spaces, I thought about the long journey here, about the risks of standing up to power and the greater risk of staying silent. Maria Garcia now leads our patient advocacy program, helping others understand their treatment options. "You didn't just save our lives," she tells new patients. "You showed us there's always hope if you're willing to look beyond the obvious." The jade pendant catches the morning light as I begin another day of patient care. Each person who walks through our doors reminds me why I chose this path, why I refuse to be silenced, why real healing will always matter more than corporate profits. Sometimes the best revenge isn't about proving others wrong. It's about proving there's a better way, a way that honors all forms of healing wisdom, that puts patients before profits, that remembers medicine's true purpose. My father used to say that every healer faces a choice between following power and following wisdom. Power brings quick profits but causes hidden harm. Wisdom takes longer but brings true healing. Looking at our clinic's success, at the lives we change, at the medical system we're slowly transforming, I know I made the right choice. Because in the end, true healing isn't about winning fights. It's about ending them, by showing there was never a need to fight at all. Just a need to listen, learn, and remember why we became healers in the first place.